Hello everyone, my name is Daniel Van Sweden. I'm a medical student at Wayne State University. This is my poster project entitled Thromboelastography Profiles of Hemophilia A Patients on Emicizumab. I did this project with Nurse Charity Statler and Dr. Mira Chitler of Children's Hospital of Michigan. This is a poster project, however, because the print is so tiny and the slides are so busy, I decided to break it up into slides. So to give a little bit of background on this project, Hemophilia A, as many of you know, is an inherited bleeding disorder that's caused by a factor VIII deficiency. Emicizumab is a relatively new monoclonal antibody drug. It kind of has factor VIII mimetic activity and is very effective for bleeding prophylaxis. However, it does not really treat breakthrough bleeding. One of the advantages over factor VIII is that emicizumab can be administered subcutaneously and is associated with a steady-state correction of coagulation. Traditionally, factor VIII replacement therapy has been monitored using the APTT assay. However, the APTT in patients on emicizumab has been found to be artificially shortened, and so it's kind of inaccurate. We can't really use it. Thromboelastography, or TEG, is a novel coagulation assay that we can use to measure the bleeding profile in whole blood. And we have found that there are very few publications that have attempted to determine the profile with patients who are taking emicizumab using TEG. So this study is to describe the tissue factor activated TEG characteristics in patients taking emicizumab, two of which experienced breakthrough bleeding. So once again, just to kind of restate the objectives, the purpose of the study is to determine the sensitivity of the TEG parameters. Alpha angle, clot formation time, reaction time, or maximum amplitude are four of those parameters that we're looking at. And why do we want to do this? We want to see if there's a more sensitive lab assay that can be used to predict breakthrough bleeding, as well as monitor patients who are taking emicizumab to see if we need to adjust their dosage. So what methods we used is we used a retrospective chart review at Children's Hospital of Michigan. We obtained institutional review board approval, and we looked at patients from 2016 until 2020. So TEGs are normally done as a standard of care, so we're able to look at all the parameters for the TEG and kind of compare them. And below here on the bottom is kind of a printout from a TEG. This just gives you an idea of what the parameters are. Moving on to the results, we were able to include 22 patients with an average age of 11 years old, a range of 19.7 years, and average time since start of emicizumab of 45 weeks. We were looking at their charts to see their bleeding descriptions, which varied from bleeds with trauma to spontaneous unprovoked bleeding, so mild to severe. So 5 patients we found had breakthrough bleeding with trauma, while 2 exhibited spontaneous breakthrough bleeding. Table 1, which you'll see in a moment, will give you the exact results, the averages of all the TEG profiles that we found. And to kind of summarize, patients exhibiting breakthrough bleeding showed a 24% increase in clot formation time, as well as a 25% increase in reaction time, suggestive of delayed clot formation. And so that kind of tells us that tissue factor TEG assay is going to be the most desirable to use to predict breakthrough bleedings. We also got the APTT from the charts just to kind of try and characterize it. We used the cutoff of 21 to describe patients with a prolonged or normal PTT. And then we also, we kind of compared that to their bleeding profiles to see if they were bleeding or not bleeding. And based on the PTT and their bleeding profiles, we were able to describe true positive, true negative, false positive, and false negative. And from that, we were able to derive the overall sensitivity and specificity of APTT. And we found that the overall sensitivity was 29%, which is very low, which we use that to rule in diseases. And the specificity is 89%, which is decent for ruling out disease. So APTT is still a decent test, but it's not the most sensitive. And this is another table just showing our results. And just to kind of give you an idea, these are the two most important numbers right here, 24 and 25% increase in K and reaction time for bleeders versus non-bleeders. So we can look at TEG profiles and see what their reaction time or their K value is doing to kind of identify which ones might bleed and which ones may not bleed. To conclude, this is the first study to utilize TEG to determine its utility to produce breakthrough bleeding in patients on emicizumab. The results of the study do show that TEG may be helpful in patients receiving emicizumab. Currently, many hospitals do not actually have access to the tissue factor TEG machine, so they are only able to use APTT. However, for the reasons stated before, it's not as desirable, but it can be used. There were some limitations with this study. It was a very small study, and some centers use kaolin, some centers use tissue factor, so even the TEGs themselves are not quite standardized across centers. So we want to do further tests with more patients and different techniques to determine if this effect is the same. Once again, next steps, we hope to do some more statistical analysis as well to hopefully better characterize the efficacy of TEGs to monitor patients on emicizumab. And here are my references. Thank you very much for your time.